Hi, my name is Dr. Pecoraro. I'm a chiropractic physician in Westfield, New Jersey. Today I wanted to hopefully take away some of your fears that people with sleep apnea often have about the masks. And I'm speaking to you not only as a doctor but also as a patient. So I have personal experience with this. Now, in sleep apnea, speaking about obstructive sleep apnea, which is when your throat, which is open for you to breathe, even at night, when you lie down, it closes up, and so you can't breathe. And when you're sleeping, you'll actually stop breathing. Now, usually you won't be able to tell yourself, but your spouse will be able to tell. They'll hear you snoring, usually loudly, and then they won't hear anything. You'll stop breathing. They won't see you taking in breath, and all of a sudden you'll snort real loud and start breathing again. And there may be quite a bit of time in between that space. Might be short, but if there's a lot of time in between there, you could be interfering with your breathing quite a bit. So if you are having this happen, if your spouse sees this happening, you should at least be checked for sleep apnea. So now, one of the cures for sleep apnea is what's called the CPAP machine. It's a little machine that sits next to your bed, and what it does is it pushes air, regular room air, down your throat at a pressure strong enough to keep your windpipe open, but not strong enough to cause you any harm. So a lot of people do not like having this mask. There's a mask that fits over your breathing areas, and many people don't like this. But I want to tell you that there are many, many different kinds of masks. I mean, I don't even know how many kinds there are now, but you can look up on the internet for different kinds. You can ask your doctor about different kinds. You can ask the place where you get the mask about different kinds. But I've seen kinds that cover both your nose and your mouth like this. There are some that just cover your nose. There are some that stick in your nose and in your mouth like a football mouthpiece. So there are a lot of different kinds. So if you find one that you don't like, ask around to your doctor, the supplier, and on the internet for a different kind, one that you might like. Now, another thing that many patients are afraid of is having to wear this apparatus on their head, because you usually wear something to hold it on your head. And they're afraid it's going to be uncomfortable. Now, personally, I did not find it uncomfortable. I didn't even know it was there most of the time. The other thing that many people are afraid of is that they won't be able to get this off if they need to. And I want to assure you that that's not usually the case. Most of the time you have more trouble keeping this thing on than having it, it falls off all the time. You have to kind of almost struggle to keep it on all the time, make sure it's tight enough, and just the least little hit like this usually will knock it off. But it is important that you have this done, or one of the other treatments, because this interfering with your breathing can affect other parts of your health. But this video is mainly to help you to not have fear of the treatment, and also to help you to know how to recognize it, which I said your spouse or someone in the room usually recognizes it before you do. This is what this video is for, the purpose of it. So I hope it's been helpful to you, and I'll see you again at a later date. Thank you.